Hi everyone, my name's Mary Hill. I'm Head of Policy at NHS England for Health Inequalities Improvement. So I work in Bola Awolabi's team. So this is breakout session 3. So we're going to be having a series of popcorn presentations. I really like the name of that one. It's making me feel rather hungry though. So we've got 3 speakers for the session, each of which have got 5 minutes each. So we're going to be hearing from Raj Johal from Derby Asian Strategic Partnership, and then Carrie Duran from North Yorkshire and Humber region, and then Gabrielle Quay from Black Thrive in Lambeth in London as well. So without further ado, we will kick off with Raj. Raj, are you there? And I think we've got some slides to share on the screen as well.
Yes, I am. Can you hear me?
Yes, yes, we can hear you. Fantastic. Over to
Okay.
you.
I'm part of DASP. I'm one of the directors there. We were funded with some funding from DHIP, some seed funding last year. It was a co-led project with Derby City Council Community Action, and us as community connectors had the funding to go out and reach into the communities. We, as DASP, are mainly working in the South Asian community, and we supported elderly individuals, so Asian males and females over 60. We addressed the mental health and next slide, sorry, early cancer diagnosis, and we had a lot of in-depth conversations with both male and females around menopause. And there was a lot to learn on that. The groups in the different sessions we had with over 37 individuals in 8 different groups. In every group, menopause came up and the lack of support in the community and the lack of kind of conversations, the taboo around the whole menopause subject. So we got the opportunity to go and talk in depth to individuals about menopause. And off the back of that, we have opened a South Asian menopause group for individuals to come on a one-to-one basis and talk further about their concerns and the taboo around menopause. So in effect, we're ongoingly providing a safe space to raise and discuss issues in the South Asian community, thanks to the Community Connector funding. We have secured a second small grant for 2024. The work is continuing, and it's working really well. Next slide, please. The learning that we've had as connectors from this funding that we've had is that the funding is relatively small, although it does create a significant difference in the activity we can do as a small group. It does take time to plan activities and complete all the monitoring required with the small seed funding we get, because we have smaller groups and connectors joining us all the time. But obviously it's important that we continue having the support of DHIP to be able to deliver what we are currently doing. That's it in a nutshell. The agenda has been influenced by the Core20PLUS with a focus on the 5 clinical areas. And we've provided structure and focus on what we want to do in the South Asian community. There's no other issues really to report other than many connectors have other jobs or roles, so it becomes a bit limited on how much we can kind of do in the community with the limited amount of funding. And obviously we have to attend training, meetings and access support. Whilst we're doing our day job, this becomes a bit difficult at times, but currently we are managing it, and the seed funding is making a huge difference, as you can see in the community.
Fantastic. Fantastic. Thank you. It's really interesting to hear about all of that, and just interested as well. How many connectors are you kind of working with as part of the partnership?
In our group, there's about 6 of us. And then obviously widely, you've got the other organisations working in Derby with DHIP. So like the City Council, Community Action, and the other community connectors that are connected to that.
Brilliant. And just remind me that DHIP is the Derbyshire, is that their
Yeah,
partnership?
Health Inequalities Partnership, sorry.
Fantastic. Thank you. Thank you.
Sorry, I thought it was the same name across the board, but obviously no, this is for Derby, so yes, that's
Yeah, brilliant.
the abbreviation of that.
Thank you. We've got one hand up there. I just was wondering if somebody's got a
Sorry,
question.
I was going to just
Hi.
ask whether we can ask questions or not. I know you're on a really tight time. I was
We
just
are
really
going to try.
keen to find out how you got the people there in the first place. I mean, you said you've ran 8 sessions, and you've had 37 people. What's been the hook? Have you gone to kind of groups that have already were set up and were there for another reason, or have you kind of managed to attract them in a different way?
So DASP is made up of a lot of community leaders in different organisations. And I myself is one of the directors in Derby that manages direct payments. So we get funding for Skills for Care. Therefore, we're constantly on an ongoing basis doing training in the community and reaching out to the communities, the South Asian communities and different groups out there. So as we do carers projects and other various projects between us. So what we did was we invited individuals to come and speak to us that don't get the opportunity to connect in the community to discuss health issues. And that's how we pulled the individuals together. I think on one of the slides, the 8 groups, kind of 37 participants attended, and that was made up of the different kind of work we do in the community. We were able to bring them all together in the 8 different group meetings we had. I think it was easy for us because I train over 600 people nationally on Skills for Care funding. So we had a pattern, we had, kind of an agenda to follow to make sure that individuals do attend, because like with anything, there can be a lot of dropouts.
Brilliant. Thank you so much. I'm going to move us on now because of the timing. We've got a bit of a timer going on, but that's fantastic. So I'm going to move us on now to Carrie Duran from the North Yorkshire and Humber region. Carrie, are you there?
I am, I'm here.
Brilliant. Fantastic. Sorry, you can hear my timer going off. I'll put myself on mute. Over to you.
Can you hear me okay? Yeah. So we'll start with this slide. So this is us. We are the Humber and North Yorkshire ICB region with a population of 1.7 million. The entire area is a mixture of urban, rural and coastal, just on the right-hand side. So East Riding, North Yorkshire and North East Lincolnshire, all coastal communities there. So that's one of the plus regions that we've been focusing on. Next slide. So initially we were given some funding for the 3 health watch teams that are in the coastal communities to link in with young volunteers and with young people, to find out their experiences of accessing health and care services, particularly around the key clinical areas of asthma, diabetes and epilepsy. And then what's happened is that since then, and last month actually, we were allocated additional funding from our ICB that have supported us as well to focus on the areas of North Lincolnshire, Hull and York as well, which aren't coastal but all have their own areas of disadvantage that we need to focus on. So the model aims to empower young people within each place area to play a meaningful role in how health and care services are planned and delivered. So what we do is we recruit young volunteers aged 14 to 25 who have peer-to-peer conversations within their own communities. So that could be a school, a college, a social group, hobby groups, etc., to identify issues and barriers that young people are facing. And our main clinical areas of focus, as I've said already, are asthma, diabetes and epilepsy. However, we're keen to gather the views and experiences of all young people in relation to health and care, because we're aware that the more we listen, the more we can change. So the information gathered through the network is used and will be used ongoing to influence change on a regional and on place level. Next slide. There's a slide missing, I think. Okay, that's fine. I'll just explain it. So the idea is that each connector, each person that we recruit in each area is expected to have a conversation with 10 young people. And then from those conversations with 10 young people, they're also expected to try and recruit a further person who will go on to have conversations with 10 young people and recruit another connector. So the idea is that we are quite broad with this, and we spread the programme as far and wide as we possibly can. Next slide. So just a spotlight on Healthwatch Hull. So Healthwatch Hull have taken a slightly different approach with it. So they're still going with the connectors model of what I like to sometimes describe as a pyramid scheme. And they've started delivering Healthwatch hubs, and they've started on the 9th of January. And we've got volunteers who we've recruited that are from the student population within Hull College, and they're there weekly now, gathering feedback from their peers and around health and social care experiences and those relating to Core20PLUS Connectors. We have a co-production element with the Hull Food Alliance, the LGBTQIA+ groups, and we're bringing in different charities as well to talk about different things, just to keep it interesting. And then from this, we've got 10 student volunteers who are now connectors in Hull. Next slide. Following the 4-week period, trial period at these hubs, we'll be putting together some information to reach out to other colleges and do a little bit of a tour. But the idea is that if we get our 10 connectors in each, they will then go on to recruit further connectors and support them through our programme. And we do have lots of training and things available for young people ongoing. And the vision is to have weekly Healthwatch hubs in as many secondary schools, colleges and universities as possible. Next slide. And some of the feedback from our young people. I'll just leave it up there for you to have a little look at there. So all of this is being fed back into the system on an ongoing basis.
Fantastic. Thank you, Carrie.
Thank you.
It's really, really interesting as well to hear from the views of children and young people as well. And I think this is one of the kind of, particularly as we've been focusing on children and young people in more recent phases of the Connector programme as well. So it's really good to hear those insights. Just wanted to check if there was a question, any questions for Carrie before we move on. I think we've probably got 1 minute if anybody did want to ask anything. I can see something in the chat. I don't know if this is from the whole chat or from this group chat. I'm not as familiar with Zoom. I'll be there's something around.
Sorry, yeah, that was me. I was just asking about, I was just interested in how much time a young person might be expected to give to the project as a connector. So sorry, Mary, I should have said that in this group.
So, obviously, because it was a really quick presentation, I didn't go into as much detail as I would have liked, but we've tried to design the model so it's as flexible as possible. So actually, although we've said each young person is to have conversations with 10 peers, it might be that they only have one conversation. But we wanted those conversations to be organic, so it's not a case of necessarily setting up anything too formal, although we get into the point where we're starting to get young people who are really passionate, who want to do that little bit more, and perhaps there are health and social care students and things like that. So it's as much or as little as they're willing to give to it. They've got a full suite of training, which obviously does take time, but that will then give them work experience for their university applications or wherever they want to go on to the next stage in their life. And it is, like I say, just organic conversations, and then they just log that on a centralised database for us.
Brilliant, thank you. Right, I'm going to move us on very quickly. It feels like we're moving on quickly, but that's the intention of this session. So over to Gabrielle now from Black Thrive in Lambeth.
Hello, my name is Gabrielle. I work for the Children, Young People and Families Department in Black Thrive, Lambeth. Just to give you a little bit about us, sorry, next slide. Just to give you a bit about us, Black Thrive is a VCSE that sit between the community and statutory services with the aim of supporting mental health and wellbeing. We've been working on a community connectors programme that's focusing mainly on children's mental health, specifically the wellbeing of Black mixed heritage kids in primary schools. And as you can see, these are some of our connectors. and I'll kind of briefly go back to that later. We've been facilitating sessions with parents, staff, and students to try and gain an understanding of mental health and wellbeing in the primary schools and produce recommendations across the 5 boroughs, which are Lambeth, Southwark, Greenwich, Bromley, and Lewisham. Next slide, please. So how's it going? What is the engagement like? I'll briefly explain some of this data. However, feel free to ask any questions or circulate this for a better understanding. But we've been engaged with the schools in varying degrees of success, but we're continuing the work still. So we've been coming out with key information and we'll be sharing some of those learnings here. Through the focus sessions, we've engaged Lambeth and Southwark schools to progress with the recommended initiatives we suggested. We're continuing engagement with Lewisham and Bromley, doing sense checks to ensure that the whole school community needs are met as much as possible. And we have a few co-production sessions with Greenwich to do. The feedback will be ready at the end of the month with regards to that. I think one of the learnings we've realized is that co-production can sometimes be slow, but it helps get us the best information possible. For context, some of the main themes that were raised in these sessions were resource, lack of time, communication, and staff capacity. Can we go on to the next slide, please? So the initiatives so far, when deciding our initiatives, we wanted to make sure they met the needs of the whole school community, the themes raised, and also looked at what the school already has in place and what's best for the whole school community. We have some creative initiatives that we thought would be great for the well-being of the children. Staff training we thought would be imperative, so we've actually been working with the Black curriculum and they're going to be giving free workshops in schools, which is amazing. But we also have our community connectors, and we recognise the need to build and maintain the relationships in schools. So a community connector will be providing the additional resource to support the embedding of the initiatives, to support mental health and well-being, and enable sharing of learning and good practice across a wider network. From these learnings also, we decided that it would be best to have a well-being kit or resource. We're not really sure what that's going to look like yet, which is scary, but I think it's a good thing because it allows for creativity and something new to be built. And with that, we're working with Camusi, which is a London-based design lab. And so the toolkit is meant to ensure and support the whole school community once again, but also to engage everyone in a healthy conversation about what we care for and how we care for ourselves best. And I guess sharing that with your teachers, your parents, and yourself as a student. We feel like, although it's a work in progress, so far we've had 120 teachers and 25 families sign up to join this. And so for us, it's made it clear that there's clearly a need for this in the community and it's really spurred us on. And so that's why we're really excited about doing that work. And hopefully at some point, I'll be able to update you guys on what that actually looks like or be able to share it with you guys. Can I go on to the next slide, please? Our key learnings. We've had some really good key learnings from this work. I think facilitation being a big one. Things like building trust, brace space, practicalities and dynamics are key for us when trying to facilitate these sessions. Ensuring respect and different perspectives were listened to, and also listening to understand was very key for us rather than just trying to bulldoze with our own suggestions and opinions. So that's something we had to take in and think about when talking to parents and parents, teachers, and the kids with regards to engage in schools. As you can see, there are some other things, other learnings we came up with, but being adaptable was also one I thought was really important for us because you have to meet the schools where they're at and ensure that it is actually a collaboration in trying to ensure systems do change. I think another one with communities was trying to remain neutral. Sorry, my time has gone off, but trying to remain neutral, so that you can kind of have a bird's eye view and get the best perspective of the actual situation, because I think sometimes it becomes easy to get kind of convoluted with the amount of work that is actually there. And next slide, please. These were our next steps. So we're going to continue to engage our community connectors in the school. That's actually a process that's started. and it's exciting. We're definitely continuing engaging with the schools. We might go back and do feedback sessions and other sessions just to evaluate the work we have done, and hopefully there'll be scope for more of it, and as well as our resource kit, which I was talking about earlier, and hope to be able to share at a later point. That's it. So,
Fantastic, thank you. I think we've got about 1 minute before we're pulled back into the main room, but I just had a quick question as well around, so have you reached out directly to the schools, or do you engage with sort of the borough councils as well?
Yeah, we reach out to the schools. We actually go into the schools to give the sessions. So we go into the school, we give it that during the teacher session, we hijack their staff meetings.
Okay.
For the kids, it's fun because we get to give them a free class, I guess. Instead of doing maths or something, they get to have a creative drama workshop. And with the parents, we had to think about things like going when they drop off their kids is the best time to really get them, rather than when they're leaving with their kids, because no one really wants to stay after 4 o'clock. So yeah, we go into the schools and get the information, which I think was key to really get them where they are rather than trying to bring them into our space.
Fantastic. Did anybody else have any further questions they wanted to ask? I think we've got 1 minute.
Hi, I've got a question. Hello,
Okay.
Gabrielle. I'm just up the road in Croydon, actually. I found someone who's close to home. Everyone seems to be out in the sticks.
Hello.
So my question to you is, while you're doing the work with the children, couldn't one of your teams start to engage with work with the adults while you're at it, seeing as you're communicating with the children?
Yeah, so we do engage with the parents as
Can I
well.
just interrupt you? I don't really want my camera on because I don't want to be recorded. That's the only reason, so forgive me. Yeah.
No problem. But yeah, we just because we've got, I think, 55 seconds.
Yeah.
Yes, we do go into and speak to the adults. We speak with the parents. And that's also a major part of the work. We get a lot of key information out of them. And we hope that the community connector role will allow for all three, the staff, the children, and the parents to engage. So we're hoping our community connectors will engage with the adults and kind of help with some of the issues that aren't met within the school community, because we realize that they do have knock-on effects. So such as financial needs in the home do affect the needs in schools as well. So yeah, we're hoping that it's kind of have a 360 view rather than just looking at schools.
Yeah, thank you. That's great.
Thank you. And thank you to all our presenters today. It's been really